All right. Hello, everybody, and welcome to UC GIS Week. We are having this afternoon session on geospatial data, policy, and health insights. We have three 8-minute lightning talks with a few different speakers. First up, I want to mention that we will take all questions at the end of the three talks. Please feel free to leave questions in the chat as they come up. Otherwise, you can also raise your hand once we get to the Q&A and be able to ask your question that way as well. First up, I want to introduce Jane and Nathaniel, who are here representing the California Geographic Information Association.
All right, if I could get my screen share to work. Sorry. Okay. Sorry. Oh dear. Try that again.
I think we were good, Jane.
We were good? Yeah, but
Yeah.
I couldn't see my notes.
Ah,
I'm sorry. So I'll just have to wing it. Let's try it again here. Okay. All right, so you can see this now. All right, so thank you. Thanks for inviting us. I am Jane Schaefer-Kramer. I am a geographic data specialist with the California Department of Water Resources. And Nate, I'll let you introduce yourself.
yeah. Hi, I'm Nate Roth. I am a science and data advisor for the California Department of Conservation and a proud UC Davis alumni.
Right. And I did not attend UC Davis. I learned GIS at American River College. So, but we are not speaking here today as representatives of our employers. We're here representing a GIS professional association, the California Geographic Information Association. And let's see if I can advance. Oh dear. Okay, so we wear different hats in our private and personal lives, but part of this is our affiliation. I'm actually a member of two organizations, the California Geographic Information Association, CGIA, and also the California chapter of an international organization called the Geospatial Professional Network. And these are both nonprofits. They're in California, they're somewhat complementary. And I've been involved with the advocacy committees of both of these organizations for some time. And we're going to talk about here, Nate and I are both involved with a joint ad hoc committee on things that GIS practitioners sometimes do that could get themselves in trouble with the California Board of Professional Engineers, Land Surveyors, and Geologists based on the California Business and Professions Code. Now, that's not really the title of the ad hoc committee, but we kind of shortened it a bit to Ad Hoc Committee on GIS Professionals in the Practice of Survey, and then we just call it the Ad Hoc Committee. So this was launched based on a recognition of a problem that GIS practitioners, especially those new to the profession, and not even the profession, just who use GIS in their work, may not realize that just because there's a tool in your GIS software that you can do, and you're going to do something that may actually be legally reserved for the practice of licensed surveyors. And in the last few years, it's come to our attention of two particular cases where GIS practitioners were cited by the board. And so Nate's going to talk more about that. But as a result of this, in 2024, our advocacy committee in CGIA decided to take this on as a topic to discuss and debate and figure out how we can make it better for GIS professionals. And after doing a lot of research, we decided to start with a 2-page document that we prepared and published earlier this year. And that is just a cautionary guide. And we started out trying to make it a best practices guide, but then we realized that we can't say what best practices are because the crux of the problem is that the language in the law is quite vague and it's very old language. It's been there since before GIS. And so we're just issuing cautions. And so this document is now available on the CGIA website. I will put the links in the chat later. And our mission here, we're grateful to be here because we want more students and young professionals to know about these issues. So I'm going to turn it over to Nate now.
Yeah, thank you, Jane. So the reality is that Business and Professions Code, sections 8700 through 8805, that's where that was passed into law as the Professional Land Surveyors Act. Most of our challenges as GIS professionals originate from section 8726, which defines land surveying. And I've highlighted here a couple of the particularly problematic portions of that definition. The locate, relocate, establish, reestablish, retraces, all of those not being terribly well-defined terms. The alignment or elevation of any fixed works embraced within the practice of civil engineering as described in section 6731. That's the section that defines licensed engineering, like civil engineering, those you might have seen as people with a professional engineer's licensure. But those fixed works include irrigation, drainage, water power, water supply, flood control, harbors, municipal improvements, railroads, highways, tunnels, airports, airways, water treatment, sewage, foundations, grading, framed, and homogeneous structures, buildings, or bridges, which is an awful lot of constructed materials, which means, among other things, if you're working with a data set that includes building footprints, you're probably touching on this in some way. Or determines the configuration or contour of the Earth's surface, or the position of fixed objects on, above, or below the surface of the Earth by applying the principles of mathematics or photogrammetry. We start running into that. You start building a topographic model from drone imagery. You're probably treading into this particular area. Or if you're doing slope and aspect calculations from a digital terrain model, chances are pretty good that you should be aware of this. Not necessarily as an absolute don't do it, but that if you gotta be aware that there are other considerations that might apply. Similarly to the fixed works, there's the locate, relocate, establish, retraces property lines or boundaries of any parcel land, right of way, or easement. So if you start dealing with property ownerships, you could be starting to find yourself in this area. And then there's a couple that I find particularly problematic beyond that. Determine the information shown or to be shown on any map or document prepared or furnished in connection with the above, or creates, prepares, or modifies electronic or computerized data relative to those. And then the last one to wrap out on it is rendering a statement regarding the accuracy of maps or measured survey data. So I suspect most of you that have been involved in GIS can see why some of these could be potentially problematic. In California's case, there are a few exceptions for pieces of this related to people with licensure as a civil engineer or a professional geologist, or in some cases for those that are an architect for other purposes. Like there are a few exceptions, but none of them at present apply to those of us that are trained in GIS, use GIS, even if we have some form of GIS certification. If we could move on to the next one, Jane.
Okay.
Next slide.
I'm trying.
Okay.
Yeah.
So, one too many.
Oh no.
So the question is, okay, how prevalent is this? Working on a Public Records Act request to BPLG, the Board of Professional Land Surveyors, Engineers, and Geologists, that covered a period of about 5 years. There were 62 citations for practicing surveying without a licensing. Of those, 38 were not GIS related really at all. 24 were, and then the remaining sets of them are from within those 24. So it's frequent that if people got cited, they got cited for multiple violations. By far the most common were folks doing things that fall under what we've started calling a site map category. It's starting to relate property boundaries to fixed works of various kinds. One of those was dismissed because it really did no harm, but the majority of them were citations that the person cited has eventually had to either pay up or follow some form of cease and desist type of order. A couple of them for locations or elevations of fixed works. Frequently, those were utility related. A couple for doing contour of the Earth's surface, including one that was fairly specifically drone photogrammetry related. A couple about statements about MAC accuracy, and one person who really probably should have known better, who tried to prepare a subdivision map for submission under the Subdivision Map Act, which got cited for a great many things. Okay, moving on, please, Jane. So what does that really mean? And it's hard to really provide coherent guidance because there's a lot of uncertainty, and those that have been cited have really only been cited after somebody, generally a licensed surveyor, engineer, or geologist, has referred the case to the board. And then the board has decided there's sufficient evidence to be worth pushing forward with a citation. So if it doesn't get reported, it's essentially not being enforced, and it leaves a great deal of uncertainty. So what are the higher risk activities? Doing site plans where you're identifying dimensions, so distance from a property boundary to a structure. Doing utility mapping, particularly if it may have any type of public safety relationship. Modifying property boundaries, creating sort of the original topographic data, and then making quantitative statements about map accuracy. Others that we think of as lower but non-risk, so resource mapping based topographic data processing of various kinds. So, okay, what's the slope? Do we have a little bit of a landslide risk here or a lot of one? Larger regional land use planning type of activities. The use or the contributions to crowdsourced data. We know of nobody that's been, or groups that have been cited in California for it, but there are definitely some overlaps to the definition of public land surveying. Non-dimension site planning, so things that don't have directly attached dimensioning, particularly if they don't appear to be, don't give the impression that they are survey quality data. And really anything that shows the relationship between property boundaries and fixed works without dimensioning it. Okay, Jane, let's move on. So from our do's and don'ts document with CGIA, really the crux of it is don't do things that look like they're stepping into the realm of professional surveying, as defined in section 8726. We do have a set of sort of do's, so things that we can do as geospatial professionals that we can do to reduce that potential friction. Next, please, Jane. So don't do documents that have dimensions from fixed works or boundary lines. That's one of the, particularly don't do those for any type of commercial sale. Be careful using GNS or GPS to identify the position of surface or subsurface fixed works, including utilities, particularly if there might be a safety element, like some form of setback from a power line relative to to individual safety. Don't build your own digital elevation models and then distribute them out to the public, or at least be really cautious about it. Don't go and make changes or corrections to parcel boundaries. Avoid making a quantitative statement about the accuracy of maps. And one of the ones that people, non-GIS folks, have gotten in trouble for, that overlaps, is offer to procure surveying services for somebody. There are fairly specific rules about who can procure surveying services. It has to be either a surveyor themselves or an engineer in some cases that can say, hey, I'm going to go and get somebody to survey this for you. Next, please, Jane. So please do be familiar with Business and Professions Code, Section 8726. It does actually matter. When you're producing maps or other data products, please do include a disclaimer of some kind that states fairly clearly that this is not a survey product, and make sure that any acceptable use statements that you make are consistent with that. Provide the metadata, always good practice. Work with surveyors when you need to, and advocate for the clear regulations and collaboration between the groups. Next one, please, Jane. So back to you.
All right. Yeah, so I'll put these links in the chat. What else you can do is get informed, download a copy of that document and read it and keep it handy, share it. If you want to get more involved with the GIS community of practice throughout the state, join the CGIA email list. You do not have to be a member to join that email list. Engage with GIS professionals and surveyors. If you are going to be doing any of this kind of work that Nate talked about, it's good to get to know a surveyor or two. And add them to your professional network, and consider joining a professional association. And most of them do have a student dues component. So thank you for your attention and stay cautious.
All right. Thank you so much, Jane and Nate. Just a reminder, we will take questions at the end, but feel free to leave them in the chat as they come up. Next up, I'm going to welcome Debbie O of UC San Francisco, who actually has 2 talks to present us with today.
All right. Thank you all. I have to figure out which one's first. Okay. So let me. Is this the right window?
This is your presenter view.
Okay. Better?
Yes.
Okay. Maybe I should have just unplugged my second screen, but at this point it's too late. Thank you all for this opportunity to share. Thank you for attending in an afternoon session. I know that the afternoon session people seem to have dropped off a little bit more, so I appreciate your time. I had submitted 2 different projects. So one is for this Rural Atlas or Rural Cancer Atlas as a lightning talk, and then I had submitted for our Health Atlas as a workshop. So just so you know, the first talk is a little bit shorter. Maybe it'll be 5-10 minutes. And the second one will probably be like 10-15 minutes. And for those of you who want to do a little bit more hands-on or ask more interactive questions, maybe we can do that toward the end. Okay, so first project, the Rural Cancer Atlas. Let me introduce myself first. My name is Debbie O. My background is in epidemiology. So I was trained as an epidemiologist at UCLA. But I wear a lot of hats. And I also have some background in graphic design, which is kind of like the way I paid my way through grad school. And so data visualization is sort of the sweet spot in between those 2 areas. At UCSF, we manage the cancer registry, and so we work a lot with cancer registry data. So that's kind of how I got here. And let me start talking you through our project or the why of our project. So we work a lot with cancer data, especially in cancer disparities, and we know that rural populations have different cancer patterns. So for cancer incidence, there's lower incidence for breast and prostate cancer in rural areas, and this is likely due to, lower screening rates, higher incidence for lung and colorectal cancers, and, in some risk factors may be higher in rural areas such as smoking or obesity. Uh, it's also been reported that there's higher mortality for lung and colorectal cancers in rural areas, and that might be related to healthcare access. So when you're trying to do research with rurality, on rurality, it's uh, there's a whole world of different measures that you can choose from. And different agencies have come up with different definitions. Single agencies have come up with multiple definitions themselves. There's different kind of binary, urban versus rural, but there's also multi-level ones where you can see different steps. Some of them are not necessarily ordered categorical. You also have to consider if you're looking at the county level, zip code or ZICTA level, census tract. Um, so for this project, we had looked at a bunch of different commonly used definitions of rurality. So there's urban areas, which is used by the census. There's RUCC, Rural Urban Continuum Codes. USDA has three of them. So urban influence codes, frontier and remote zones. Oh, actually four. And then rural urban community areas, RUCA. Um, then there's a whole, I don't want to walk you through all of these, but there's a lot of people who have kind of put a lot of thought into how we define rurality. For our purposes, so we work with the Cancer Registry, but we also work with the Cancer Center at UCSF, and we are interested in serving the 25 county region catchment area where most of the UCSF cancer patients come from. And so we wanted to figure out what's going on in this region and to be as granular as possible. And for that reason, we chose to look at the census tract level, which you probably already know is, it's a unit about 4,000 people. It can be very big or very small geographically, depending on the density of the population. So we chose these two definitions. So RUCA, which is based on commuting patterns, and percent rural, which is so based on percent residents who reside in census blocks that are designated as rural. And that's kind of a mouthful. The census basically defines rural as anything that is not urban, which is super helpful. But they define urban as, a place that has like a lot of people or a lot of housing units in one place. Okay, so just so you have a sense of what RUCA looks like, you can have a metropolitan area core, so that's like a more urbanized area, or you can think about, how people flow into these urban areas. Or there's on the other end of the spectrum, there are rural areas, but there's also small towns and like the people who commute to small towns. So there's a whole range, and it's sort of ordered, but it's not exactly ordered. Um, so as mentioned before, we are interested in the 25 counties within the the UCSF Cancer Center catchment area. And what we did is we divided these into four regions based on the California census regions. And this is just so that we can have more granular insights into what is going on into each of the regions, since we know that Northern California, rural areas are going to have very different issues than in the San Joaquin Valley or in the Bay Area. Okay, so if you're interested in looking at the Rural Atlas itself, it's a Tableau dashboard, and it's cancerregistry.ucsf.edu/rural atlas. This is what it looks like. And you can see straight off that, so on the left, we use the definition of percent rural. So that's the census definition. And you can see it's like a little bit more patchy, I guess you can see. And then on the right, you have RUCA. In the next tab, you can kind of filter through and look at incidence rates, or you can look at cancer, the stage of diagnosis, or survival. So it's 5-year survival for, I think it's 5 different cancer sites. So it's breast, prostate, colorectal, melanoma, and I might be forgetting one. Oh, and lung, I believe. So you can kind of toggle through and figure out what you're interested in looking at. And I'll take you through an example. There's also these little dot plots, which are not maps. I know this is a GIS audience, but just to give you a sense of, where the differences are. My eyes zoom into like where the dots are not overlapping. And similarly, this is just set up in a different way. Okay, so here's an example I'm going to walk you through. Melanoma, which is skin cancer, a type of skin cancer. So if you look for male melanoma, you can see in the Bay Area, rural areas have higher rates of male melanoma. It's in fact 86% higher. But if you're looking at the RUCA definition and you're looking in the Central Coast, it is actually lower in rural areas. There's a 61% decrease. And this is kind of what the map looks like. So percent rural has higher rates of melanoma in rural areas for the Central Coast. And for RUCA, there's lower rates of melanoma in rural areas. So for female melanoma, it's very similar where it's like 103% increase in the Bay Area in rural areas, but in the Central Coast, it's actually a decrease. And you kind of see that in the map. And part of that is just because the definitions are different. One is based on how dense the population is, and one is based on commuting patterns. And so depending on how you're thinking about cancer risk factors, you may be thinking about access to care, in which case commuting patterns matter more. But if you're thinking about other exposures, then maybe percent rural might make more sense. And then I just wanted to kind of show you the dots. You can see how where they don't overlap. I mean, I guess in particular, the one on the very right side, you can see how for the Bay Area, the orange dot is above. So that means in rural areas, there are higher rates of melanoma. For both definitions. But then if you go down to the Central Coast, there's just circle in orange on the right-hand side, you can see that for the percent rural definition, the rates are higher in rural areas, but the rates are lower in using the RUCA definition. This is just showing it another way. You can see how the dots are inverted. If you look at the Central Coast column, how the orange dot on the top line, the orange dot is above, but for RUCA, on the line below, the orange dot is below. So what are the takeaways? So first of all, rural areas in California are not all the same. So it's important not just to think of rurality as a monolith for the entire state and the entire country. And the selection of your rural measure may impact your results. So depending on what you're trying to look at, it's important to think about, what that rurality measure is telling you. Okay, so that was my first little talk. I'm gonna end my show. Okay, let me stop share and take you to the next one. Leave, it's this one. Okay. Am I sharing the correct screen?
That is your presenter view.
Again, okay. How's that?
That's better.
Okay. All right, so I've already introduced myself, WO. I'm going to, actually, let's pause here for a second. I'm going to talk to you about the UCSF Health Atlas. I've actually presented on this project before at UC GIS Week, but I'm sure there's new folks in the audience. I was hoping today to do a little bit more of like a walkthrough so that people can maybe try on their own and give you some tips and tricks, some not quite Easter eggs, but there's like some features that we built in that are not well known, I guess, but I think are super handy. So I thought I would walk you through those as well. Okay, so the Health Atlas is a project that we've been working on since 2019, and it has taken a lot of folks for many years to put this project together. It started out as a California only project, and just last year we expanded it nationwide. So there's data for all 50 states and Puerto Rico and the District of Columbia. Um, so, why did we put together this map? When it comes to health, place matters. Where we live, including the physical and social environments that surround us, influences our health in both positive and negative ways. Um, so, we thought it would be important to put together a website where people can access um, data, place-based data from many different places, kind of like a curated collection of place-based data and just put it all in one place. So it includes, actually now we're over 200 variables, but there's maps at the census tract, zip code, more specifically ZICTA, congressional districts, county, CBSA, PUMA, and state level maps. This is at the 2020 and 2010 level geographies, and you can do a bunch of different things, which I'll walk you through. We organize the data kind of loosely based on a social determinants of health framework. And so there's these different categories, including socioeconomics, neighborhood, environment, health and healthcare. And I'll show you those data, the what data is behind the curtain in a second. This is where the data is from. So there's over 20 different sources. We kind of hand curate all this data. I have to say that earlier this year it was a little bit of a scramble. We just wanted to make sure we had our data locked down before some stuff started disappearing. A lot of the data reappeared, so thankfully it's still out there. But we hope to just be a stable place for people to find the data that they need for their work. Okay, so this is what the map looks like. Again, you can find data for all 50 states. This is a map of 2020 census tracts, extremely low income versus disability. This is actually what you see as like a default when you open up the page. I know a lot of you live in California, so you can filter down to California if you want and see data specifically for this region. If you're interested in congressional districts or any other geography, just through the drop down, you can change that. And then you can select a different variable. So say you're not interested in, I think it was extremely low income was the default. If you want to do a different measure of socioeconomic status or poverty, or there's different measures um, of health outcomes, or there's some climate variables. You can kind of type in the search bar and it'll populate with some of the options. We are working on getting a AI feature where you can type in and it'll be a little bit more loose. Say you're interested in food, but you type in the word nutrition, and then we're hoping that the AI search will help people find the variables that they want, especially since the database is growing. So you select a second variable. So the second variable will show up in yellow. And so areas that have high proportion of both will show up as green. You can also select an area. And so again, I mentioned the UCSF Cancer Center catchment area is this 25 county region. And so here I've selected those 25 counties. And you can see on the left that there are estimates or population weighted estimates that show up like as an orange dot in the scatter plot. There's also like an orange upright bar in the histograms. And then there's the estimate in orange as well. So 31.4, 75.6. So you can do that by drawing a shape, or you can do that by selecting the counties or geographies one by one. And again, I'll walk you through that later. If you want to select multiple states, you can do that. This is looking at Louisiana, Mississippi, Alabama. One thing that I thought might be interesting to look at is colorectal cancer screening and annual checkup. So where is it that there's a lot of people getting their annual checkup, but for whatever reason are not, there's low rates of colorectal cancer screening. And so, perhaps these might be places where some efforts could be made to increase colorectal cancer screening when people do their annual checkup. Um, if you just want to take the data and run, we have a download feature where you can select the variables you want. You can also export selected areas only, or you can just take, all the data for the entire country. You can download that and append it to your own data. If you want to export a map, I mean, honestly, I just take screenshots, but if I am somewhere where like the screen resolution isn't very good, then this is a way you can export a map. And we also have tags. So, in case you are looking for something that's climate related, you can just click on the little climate icon, and that'll take you to that data. I think maybe where it might be more helpful is something about like older adults where there's variables, but they're in multiple different categories. They're not all like bunched together. Okay, so I'm not going to read these all to you, but here's all the data that we have. We have different variables for age, sex, and really granular data on race and ethnicity. This is primarily taken from the American Community Survey, which is run by the census. Various socioeconomic and indices, poverty and income, a lot of different types of data that we've pulled. A lot of it is actually from American Community Survey, but there's a bunch of other different sources. Language and ethnic enclaves. Some of this data is you can only find in Health Atlas. So our team has put together an ethnic enclave variable for Asian Americans and for Hispanics. So if you're interested in looking at that, it's downloadable. There's housing data. There's neighborhood data on the built environment, segregation, structural racism, environmental data. So we worked with the UC Center for Climate and Health Equity, and they helped generate climate data, so air pollution, heat data, extreme precipitation data. And so we only have that available for California. So it's something special just for you. There's various environmental indices, some of which may no longer be available through the government. I would have to check that. Everything keeps changing, but at some point, some of this data was not available. And then a lot of these health and healthcare outcomes are from the CDC places data, which disappeared and then came back. We don't know if there'll be a new round of this data moving forward. Okay, I'm going to take a deep breath. Here's the walkthrough. So in case you want to try playing around on your own, you can pop open a browser, healthatlas.ucsf.edu, and then your default will actually show two variables. It'll be extremely low income and disability, but you can like click on the little trash can. You can mouse over and click on the little trash can and throw out one of the variables. You'll have just one variable, extremely low income households. If you mouse over the map, so here I kind of went down to Louisiana and I moused over a census tract that has 29.3% extremely low income households. You can see on the left-hand side that when you mouse over that census tract, a line will show you where that census tract lies in the distribution. Or alternatively, if you mouse over the histogram, this is divided into 5 different categories, and this is by natural breaks. So from 27 to 42.6 will show up in this color, this blue color, and then if you mouse over that, it'll highlight those in the map. Okay, so if you want to select another variable, so extremely low income households and disability, you can kind of click add another variable and You can type in disability, or you can look under health outcomes and find it there. Um, and the scatter plot will appear. So each of these dots is a census tract. And one fun thing you could do is you can highlight that scatter plot, and the census tracts that are in the region that you highlight will also light up in the map. Which I showed you guys before, but this is another example of using that. There's also, if you toggle, so it says scatter plot, or you can toggle to a summary plot. And this is, I think, especially useful for something like census tract. So there's so many dots. If you just want to know, where is the lowest, amount of disability and the lowest proportion extremely low income households, there's a dot, you just click on it. In the map here on the right, I kind of clicked on a middle dot. So 5.9% of all census tracts have 16.8 to 27 extremely low income households and 14.2 to 19.9 percent disability. And so those will light up in the map. But I think it's nice to be able to have both the scatter plot and the summary plot. Okay, so here's an example where we're going to filter to a state. So if you go to kind of like the top left corner, you can filter to a state. So I, in this case, chose California. And then I changed it, instead of census tracts, I changed it to counties. And then if you want to select a custom area, on the right-hand side, there's this little polygon, and you can click and draw a shape over the area that you're interested in. So I live in the Bay Area, and so I drew a shape over the Bay Area. And then those counties will light up. You can also select them one by one. So above this polygon, there's like this little square with an arrow, and you can kind of select or deselect counties or regions as you like. And again, the dot will show you where that region lies in the distribution, as well as give you details about the actual estimated proportion, and it'll show you that orange line will show you where it lies in the histogram. And then again, if you just want to take the data and run, you can click download data. So the download button's up here in the right. You can select the variables you want. If you're interested only, in this case, in the Bay Area or whatever area that you've selected that's highlighted in orange, you can click that, download the data. And I just wanted to show you that when you download, so this is kind of like zoomed in a little bit, on the bottom, it's a lot of data and it takes a while to process. And so it'll kind of show you how long it'll take. If it's a huge data set, it might take a long time. We have had issues where if you download too much data, it kind of like it takes too long. But once it's ready to download, it'll be green, it'll say ready, and you can click download. And I think that is it. I'm going to stop share. And I think I didn't check for questions, but I think we can open up to Q&A.
Absolutely. Thank you so much, Debbie, Nate, and Jane. Let's give a big round of applause to all of our presenters in this session. I know I'll certainly find myself sending students to the Health Atlas for sure. Great resource. Somebody has asked for your email in the chat, Debbie, as well.
Yeah.
So I'd like to open up for questions. Do we have any hands? Well, I know I have a question for Jane and Nate from the first talk. A lot of this issue seems to stem from this vague legal language, this unclear legal language, this outdated legal language. Are any of the organizations you're involved with or otherwise involved in lobbying for some change and clarity in this legal language to make this easier for GIS professionals in California to not accidentally break laws or codes?
We're not lobbying yet. I think we're still in the phase of defining, building the case. We've scheduled a couple of brainstorming sessions where we're putting together based on, what we've seen and based on our knowledge of what we and our colleagues do, what could possibly happen and how does this affect GIS practitioners. So that's where we are. We're building the case and we're engaging with surveyors, with the surveying community. Some are sympathetic to this cause, some are not, but we're navigating that space. And then, as far as what the next steps are, we'll strategize on that next. Nate and I working for the state, we got to be careful about what we get involved with, and so, but engaging these professional associations, they are able to do that. Nate, did you want to add anything?
I think you answered it quite well from my perspective. Still a lot of exploring, figuring out what possible problems are, able to enumerate how big they are, and then trying to identify what solutions make sense and build a coalition around them, mutually from both the GIS practitioner and the surveying community. Because to be frank, most of the surveyors also recognize that there are challenges here and that clarity in those boundaries of professional practice benefits everybody.
Awesome. Thank you. And for the recording, I'll read this question that just came in the chat out loud for Debbie. Would the Health Atlas consider incorporating data regarding households without a vehicle to study healthcare accessibility?
I believe that at some point we did have access to a vehicle. So let me just poke around. We might have, when we changed from California to the national version, we might have taken that off for whatever reason, but let me check. I feel like we might already have that data.
Do we have other questions for our speakers? I don't want to distract you necessarily while you're looking, Debbie, but I do have sort of a broad question. What's next, do you think, for the Health Atlas in terms of either adding new variables or outreach, or sort of what are the dreams from the Health Atlas team on next steps?
So the first dream, which I feel like is going to happen soon, hopefully, is to incorporate AI in order to make this an easier to use tool. We started with, maybe 60 to 80 variables, and it was easy to start to navigate. But as the list of variables has grown, we've been trying to think about how to make it easier to find the right data. And so the tags were part of that, but as AI has started to seep into every part of our lives, we thought that it might be a good way um, to help users get to where they want faster. Um, I would love to hear other ideas. I mean, some other people have floated ideas like, oh, we can expand, beyond a national version, but I do feel like we have a lot of data that is census based or CDC based. So I do feel like continuing to focus on national data makes sense for the Health Atlas. I do want to share, one second. We do have no automobile access, so no automobile access. Let's just go to California just to make it easier. So this data is taken from the American Community Survey, and it goes down to the census tract level. So depending on where you want to look at the data, that is there. I believe that was what the question asked, if I'm...
Households without a vehicle, so vehicle access, yeah.
Yeah, percentage of households that do not have a vehicle. Yep, it's there.
Awesome. Do we have other questions for our speakers? Otherwise, I do know all of our speakers have given us some contact information. So if you have questions that come to you, a minute after the Zoom closes, as so often is the case, please don't hesitate to reach out to them. I want to invite folks to our last two sessions that we have today to conclude UCGIS Week. At 3 p.m., we will have a GIS Tools showcase, and at 4 p.m., we will have 3 presentations in a session on international geographies. So I hope to see some of you there. And otherwise, let's do one big round of applause for our presenters again. I know I certainly learned a lot from these talks today. And have a great rest of your afternoon, and we hope to see you again soon.
Thank you. Bye.